But we have to pass the bill so that you can find out what is in it.
The political world is buzzing about this guy, this MIT economist named Jonathan Gruber. Jonathan Gruber. So who is he and why should you care? Well, what he says might have a direct impact on your health insurance. So first off, who is this guy? This guy that Democrats are now claiming they barely know.
Some advisor who never worked on our staff.
I don't know who he is. He didn't help write our bill.
But he was paid almost $400,000 by the Obama administration, the Department of Health and Human Services, to be a consultant to help them write Obamacare. But don't take my word for it. Here's Jonathan Gruber on an Obama campaign video in 2012 in which Obama was dinging Romney for writing Romneycare, which he was then running away from, and which Gruber also helped write.
I helped Governor Romney develop his health care reform, or Romneycare, before going down to Washington to help President Obama develop his national version of that law.
Okay, so Gruber is one of the guys that helped write Obamacare. So what? Well, this controversy began when this video came out from last year at the University of Pennsylvania, where Gruber was talking about the sneaky way in which Obamacare was written so as not to make it appear that the requirement that you have health insurance or your employer provide you with health insurance, so that wouldn't appear officially as a tax.
It's just, you can't do it politically. You just literally cannot do it. Okay? Transparent financing, unless I have transparent financing, also transparent spending. I mean, this bill was written in a tortured way to make sure CBO did not score the mandate as taxes. If CBO scored the mandate as taxes, the bill dies. Okay, so it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage, and basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass. And, it's the second best argument. Look, I wish Mark was right. We can make it all transparent, but I'd rather have this law than not.
I'll make our government open and transparent. One of the things I want to do is open things up. I want transparency. I want accountability. Because the more transparency we can bring to Washington, the less likely it is that Washington will be run by lobbyists and special interests. This is the most transparent administration in history.
We have the news here in the past few days about some of the comments made by Mr. Gruber, which has sort of united that side, and they're talking about possibly having hearings and calling him up to talk about what he meant and the architecture behind this. Tell me, how does your side engage on this issue in a different way, with them going back to this well again? And what does that mean? Does it give you more opportunity, or does it continue to defend it, or is this just, you feel like fight the same battle over and over?
Well, you gave an interesting set of observations, but one that you skipped is that Mr. Gruber's comments were a year old, and he has backtracked from most of them.
But that still engaged them, regardless.
Nonetheless, you didn't have it in your narrative. And that's really important, that he is not even advocating the position that he was at some conference and said. So I don't know who he is. He didn't help write our bill. And so our bill brings down rates. I don't know if you have seen Jonathan Gruber of MIT's analysis of what the comparison is to the status quo versus what will happen in our bill for those who seek insurance within the exchange. And our bill takes down those costs even from now, and much less preventing the upward spiral. With all due respect to your question, you have a person who wasn't writing our bill commenting on what was going on when we were writing the bill, who has withdrawn some of the statements that he made. So let's put him aside. But to your further question, which is more important, and with or without him, the Republicans will try to undermine the Affordable Care Act, and we recognize that.
Professor Jonathan Gruber helped craft both Obamacare and its predecessor under Governor Romney in Massachusetts. He maintains the law is working as intended. Kind of made the point. Thank you for answering directly, and I think honestly, you're saying that people benefit from it, like it, which makes sense. I think that's true. The survey shows some people really like the ACA, but the majority doesn't. It's a slim majority, still a majority. I thought this law was supposed to help everybody. This law was never supposed to help everybody, Tucker. That wasn't the design.
Thank you very much for leading this discussion on health care. You know, you can fool some of the people some of the time, but you can't fool all of the people all of the time. And as we begin to discuss repealing of the health care law tomorrow, I would like to discuss just how exactly the Affordable Care Act benefit all Americans.
The law was actually explicitly designed first in Massachusetts and then for the nation to leave the vast majority of Americans alone. People who had health insurance that worked for them through their employer or the government were not designed to be affected by this law by and large in the near term. They were hoped to benefit in the long term through lowering costs. But in the near term, the law was designed to fix what was wrong with our system, which was focused on the 20% of Americans who did not have health insurance or were buying it through a broken non-group insurance system. The law was not, and that was the design of the law. Okay, so that's not at all what I heard the president at the time say, at all, and I was there. But, okay, fine point. Let me ask you, this is my sanity test. Are you really saying there are no victims of this law? No, not either. I'm not saying that. So who are the victims? Who's been hurt by Obamacare? Who's been hurt by Obamacare is two groups. One is the wealthiest Americans, the top 2% of Americans who had to pay new taxes. And second is very healthy individuals who benefited from a previously discriminatory insurance market. So before, insurers could kick sick people out. Well, that's bad for sick people, but good for healthy people. So if you're a young, healthy person in the market, you benefited from the fact that sick people were excluded. Obamacare said no, insurers have to behave fairly, insure everyone. That meant that for some young, healthy people, their premiums went up.
So, Lamar, when you mentioned earlier that you said premiums go up, that's just not the case according to the Congressional Budget Office.
Mr. President, if you're going to contradict me, I ought to have a chance to. The Congressional Budget Office report says that premiums will rise in the individual market as a result of the Senate bill.
No. Let me. And this is an example of where we've got to get our facts straight.
That's my point.
The average premium per person covered would be about 10 to 13% higher in 2016 than the average premium for non-group coverage in that same year under the current law.
And the fact is that the Affordable Care Act has done more to rein in rising costs, make sure everyone can buy insurance, and attack the federal deficit than we've seen in years. And that's not just my opinion, that's the opinion of the Congressional Budget Office.
A great deal has been made over the cost of the Obamacare website. Secretary Sebelius puts the price tag at about $174 million so far. Others put it closer to $300 million. But now we're starting to see numbers on how much it cost to set up all those state exchanges too, and the price is actually very hefty when you start looking at that. To start with, every state out there except for Florida and Alaska received a state planning grant, even if they did not plan to participate in Obamacare, just to study how it would fit into and affect their state governments, their existing insurance programs, and their populations. Bottom line for those studies, more than $53 million federal dollars sent to and spent by the states. Next, many of those states that were seriously considering full participation in Obamacare needed even more money. They needed committees and research and so forth beyond that initial level, and that was really costly because now we're talking about this first step coming up to $1,767,000, a little bit more than this. Bottom line for level one establishments, more than $1.25 billion. And of course, some states have taken it all the way. They're fully invested in this idea. And getting to that point cost even more. Bottom line for the level two establishment grants, well over $2 billion. So look at the total. Beyond all of the federal part of Obamacare, which we've been talking about so much, this is how much of your tax money has gone to helping the states get ready for Obamacare. More than $4 billion, pushing up toward $4.5 billion.
I find it so striking that you vilify the groups you say have been hurt. So it's rich people who are like, who cares about them? They're horrible. And then it's healthy people who benefited from a corrupt system. I mean, do you think there's any sort of decent person who's sort of doing his best who's just been an ancillary damage from this, or is it only people who kind of deserved to get what came to them? Tucker, I haven't said anything that vilified anyone. All I did was state the facts of who the losers are. They're the wealthiest Americans and the people who are healthiest in the market beforehand. I'm owning that those people were disadvantaged by the law, but let's focus on the fact that they are a small number relative to the people who are benefited from the law. More than many more people, many times more people benefit from this law than were hurt by it. Yet you just want to focus on the small number of people who who had to pay more for their health insurance. Why don't you just focus on that group?
Like many American families, Will and Tina Clark signed up for Obamacare when their employer shut down its group insurance plan. They bought a similar plan, believing promises that they'd be able to keep their own doctors.
We had primary care, a children's doctor, pediatrician, OBGYN, and then a specialist. And one by one, when we went to utilize those doctors to set up appointments for different times that we needed them, those doctors said, yeah, we don't take that plan.
Not only that, in the Dallas metro area, they had trouble finding any doctors who took their plan.
I never found another OBGYN that would take it. So I just went without.
As they paid their monthly premium, other costs mounted. Will needs an expensive shot to treat a medical condition.
It was like $20 to $50 copay a month on the group plan. Under the Affordable Health Care Act plan, that copay jumped to $150 a month.
Eventually, the couple left their nonprofit employer. Since they didn't have jobs, Obamacare dropped them. It wasn't the safety net they expected, and the Clarks aren't alone. Jennifer Huffman from North Carolina writes, overall, it is still cheaper for us to be self-pay and pay the penalty than it would be for us to carry insurance. And my prescriptions are cheaper now using coupons than it was when I had health care coverage. Stephen Kurtz from Virginia writes, our family insurance was canceled, forced onto Obamacare, lost my doctor, premiums up, deductible up, prescriptions not covered.
I wanted to focus on the over 100 million people who don't like the law, and you're saying they just don't know enough to like it. It's been a number of years now, and I marvel at that. But let me ask you a specific, discrete question here. So you said that there are healthy people who are paying more, and thank you for conceding that.
You turn over for me, Moody? Good boy.
Rick Hammett is a veterinarian practicing in rural Virginia. His insurance premiums have more than tripled.
When the Supreme Court affirmed Obamacare, I was paying $232 a month. So we've gone from 232 to 740 in the 4 years since the Supreme Court has made the Affordable Care Act the law of the land.
Those extra costs create a ripple effect beyond Hammett.
For me as an individual, it's $6,000 a year I'm now paying. I can't put back into the local economy. I can't spend it at Food Line. I can't spend it at 7-Eleven. I think the biggest thing that bothers me with Obamacare was the way it was sold. That the American people were just absolutely misled.
Tucker, that's a trivial part of the issue. The reason that healthy people are paying more is not the extra services, is that they're being asked to fairly be in a pool with healthy and sick people. The extra services are a trivial distraction from the problem. That's not what's rising costs. You know what? I assumed you were an expert on this, but I live in D.C., and I know the people who got rich from those so-called trivial additions. You can smirk all you want, but a lot of these things were added by lobbyists for companies that wound up getting rich. Well, you can see that there were a lot of healthcare providers who've made a lot of dough off this law, and a lot of lobbyists, too. Well, you can see they're the winners as well. Well, the winners, the healthcare systems had winners and losers. As with any law creates winners and losers. The healthcare systems had winners and losers, just like any law you would pass would create. Lobbyists make money off virtually any law that's passed in Washington. That's the nature of their business.
This is a rancher. She says, we're ranchers. We buy our own health insurance. Currently, we pay $650 a month for an 80-20 policy. There, she pays 20% with a $3,500 deductible. Our maximum family out-of-pocket expense, they have that. She said, we don't carry maternity insurance as we have completed our family. She said, I'm 45 years old and I've had a hysterectomy. Now, she's now found that her policy has been canceled, and the reason is because she doesn't have, it doesn't include what the president mandates in insurance policy, maternity coverage. She said, I don't need that. We completed our family. I've had a hysterectomy, but she still needs to pay for that. So the rates for a comparable policy, for which she's now paying $650 a month, are going to be $1,300 to $1,600 a month. She said, we can't afford that. They pay their own bills. They're a ranching family, hardworking family in Wyoming, and because of the law, she can't really buy the insurance that she wants or needs that's right for her family. She has to buy something that the president, who thinks he may be smarter than this ranch lady, what he says she needs to buy, not what she needs to buy for herself.
So I don't see why you pick on this law. Well, because they're forcing people to buy things that they don't want, that don't help them. And just last simple question, keep it super simple. Why should I be required to buy a plan that covers things that do not apply and will never apply to me, such as breastfeeding, prenatal care, substance abuse counseling? Those are things that will never apply to me as a non-drinking man. Why should I have to buy those plans?
Well, I mean, basically, it's a legitimate question you're asking of what should be in health insurance plans. You might also ask why a woman has to buy a plan that covers prostate or Viagra.
Yes, I would buy that. I would ask that question, exactly.
And basically, that's a legitimate debate to have, Tucker. But rather than having a legitimate debate, you just, which is a small part of the law, you villainize the major accomplishment of the law, which is to end the discrimination in insurance markets.
Answer the question. Okay, I'm a bad guy. I ask stupid questions, but I did ask a good question there. What's the answer?
The answer is that basically, as a society, we have to decide what is going to define fair insurance. And if Republicans don't like that part of the law, then by all means, go ahead and attack that part of the law. If you think the law benefits are too generous, but then that's the part of the law you don't like, fine, but that's no reason to rip the whole law down. That's taking a sledgehammer to a small problem.
That's such a propaganda line. Aren't you a professor? The benefits, I wasn't arguing the benefits were too generous. I was arguing that the benefits weren't benefits.
No, you're arguing they're too generous.
No, not benefits to me, actually. So don't call them benefits because they're not. I don't want to buy it. I don't care to have it. Therefore, it's not a benefit. So I'm not arguing that it's too generous. I'm arguing that it's stupid for my uses. No?
Well, I am not going to agree with the use of the word stupid in this context, but I will say
meaningless, but not of use.
Professor Jonathan Gruber is considered by many as the architect of Obamacare. As a former Obama administration official put it, Professor Gruber was the man on Obamacare, the guru of health care. Professor Gruber is often said in Washington to be the definition of a gaffe. That's when somebody accidentally tells the truth.
Hero John Kerry, or more likely his staff, came up with a great substitute idea. They said, look, what you economics nerds want to do is you want to say that for people with expensive health insurance plans, they will no longer get a 40% tax break. What if we instead just levied a 40% tax on the insurance companies that sell these terrible expensive Cadillac plans? We said, well, that's pretty much the same thing. But why does it matter? I said, you'll see. And they were both in that passed. Because the American voter is too stupid to understand the difference.
First of all, you haven't publicly commented on this so far. Do you stand by the comments in that video?
The comment in the video were made at an academic conference. I was speaking off the... So a second Massachusetts hero arose, John Kerry. And John Kerry said, no, we're going to tax your health insurance. We're going to tax those evil insurance companies. We're going to impose a tax that if they sell health insurance that's too expensive, we're going to tax them. And conveniently, the tax rate will happen to be the marginal tax rate under the income tax code. So basically, it's the same thing. We just tax the insurance companies. They pass on higher prices. That offsets the tax break we get. It ends up being the same thing. It's a very clever, basic exploitation of the lack of economic understanding of the American voter.
Mr. Gruber, I've been accused that I'm going to berate you or something, and I hope that you won't feel that way when I get done. But night before last, I was at the Kennedy Center Honors, where they honored Tom Hanks, famously Forrest Gump, the ultimate in successful stupid man. Are you stupid?
I don't think so, no.
Does MIT employ stupid people?
Not to my knowledge.
Okay, so you're a smart man who said some, as the ranking member said, some really stupid things, and you said the same. Is that correct?
The comments I made were really inexcusable.
Okay, and I'll leave aside the political observations, but you did say in the video we played, and everyone else has seen, I think, parts of it, you did say that, in fact, if people knew the whole truth, they wouldn't have voted for this. That, in fact, the direction you were going, the reality, and specifically I want to talk, because Mr. Goldman's a poster child for this. He has a silver plan that is relatively inexpensive. It was subsidized, it'd be even cheaper. But the shifting of some people to pay more than they previously did, because remember, healthcare went up in price. So for Mr. Goldman to get a reduction, somebody else got not only an increase, but an increase to offset his decrease.
Who already have health insurance. They're already experiencing most of the benefits of the Affordable Care Act, even if they don't know it.
That was what you were talking about. So isn't it true that, in fact, between the taxes and increases for some, that's part of the plan to reduce for people like Mr. Goldman?
First of all, I made a critical mistake in trying to conjecture with a ton of expertise.
No, but you're an expert on the analysis of the numbers and where the cost shifting goes in your microeconomic analysis. And I'm asking you, as Dr. Gruber, a smart man at a great institution that has collected over over $4 million in various fees and so on. Your analysis, isn't it true that in order for Mr. Goldman to get his reduction, and he's very happy about it, that in fact there was cost shifting, including those so-called Cadillac plans? Isn't that true?
The Affordable Care Act set up insurance exchanges which pooled risks for the healthy and the less healthy. On average, when you count for the tax credits individuals received, people are paying less for health insurance than they
I'm a taxpayer, Mr. Gruber. Trust me, people are not paying less. People like me are paying more for those because taxes are in fact a cost that's paid. Total cost did not go down. Cost shifting occurred in your model. Isn't that true?
The amount that individuals have to pay for health insurance on average fell in my model.
Well, but it didn't fall in reality.
Words matter in political discourse. You know that. The president was adamant saying the individual mandate is not a tax. Well, in fact, his own Solicitor General went to the Supreme Court and said this is constitutional under the taxing authority of Congress.
That's right.
So that's not how this was sold to the American. Not how it was sold to the American people.
No, it's a penalty. It's a penalty that comes under the tax code. It's a penalty that comes under the tax code. It's a penalty that comes under the tax code for the 1% perhaps of the population who may decide that they're going to be free riders. But most people are not affected by it.
But it's a new tax on the American people.
No. It's not a tax on the American people. It's a penalty for free riders.
Affordable Care Act tax penalty explained. Under the Affordable Care Act, if you can get health insurance and choose not to, and you aren't exempt for any other reasons, you may have to pay a tax penalty. The tax penalty is calculated based on a percentage of your household income, or a per person or per family rate, whichever is higher.
Shame on this body. Shame on each and every one of you.
We heard the Minority Leader Boehner say, shame on you, shame on you.
Well, you know, some people will do anything for the insurance company.
Under this mandate, the government is forcing people to spend money, fining you if you don't. How is that not a tax?
Well, hold on a second, George. Here's what's happening. You and I are both paying $900 on average, our families, in higher premiums because of uncompensated care. Now, what I've said is that if you can't afford health insurance, you certainly shouldn't be punished for that. That's just piling on.
For the 2014 tax year, the tax penalty amount is either 1% of your household income or $95 per uninsured adult and $47.50 per uninsured child, up to $285 per family. In 2015, the amount increases to 2% of your household income or $325 per uninsured adult and $162.50 per uninsured child. In 2016, this amount increases again and adjusts for inflation every year after that. The penalty amount is also based on the number of months you or your dependents were uninsured. If you're uninsured for less than 3 consecutive months, you won't have to pay a penalty for that time period. This is called a short gap. If you have more than one short gap in coverage during the year, your penalty exemption only applies to the first gap. When you file your tax return for the year you were uninsured, your tax penalty will either be deducted from your refund or added to your tax bill. By law, the IRS may not use liens or levies to collect Affordable Care Act tax penalties, but they may take the penalty out of your expected tax refund. Still have questions about the Affordable Care Act tax penalty?
We've set up an exchange. You are now part of a big pool. We've driven down the costs. We've done everything we can, and you actually can afford health insurance. But you just decided, you know what, I want to take my chances. And then you get hit by a bus, and you and I have to pay for the emergency room care.
That may be, but it's still a tax increase.
That's not true, George. For us to say that you've got to take a responsibility to get health insurance is absolutely not a tax increase.
The Affordable Care Act has just now started to take full effect as millions of Americans consider whether they're going to start signing up for insurance using the new health insurance exchanges. But one thing that people need to remember is that certain provisions of Obamacare actually took effect at the beginning of 2013, and they could have a big impact on your tax return going forward. Today I want to talk about 2 Obamacare taxes that you need to watch for right now. Now, basically, what Obamacare did is it included some new tax provisions that would raise revenue in order to potentially offset some of the costs involved in providing the subsidies under the law. And 2 of those have to do with high-income earners imposing additional taxes on their income.
If you've got health insurance, you're not paying a tax. If you don't have health insurance and you can't afford it, the health care bill helps you get health insurance. We provide you with subsidies. The only people who are impacted by the individual mandate, whatever you want to call it, whether you want to call it a penalty, a tax, a mandate, whatever it is, what it's saying is that we're not going to have other people carrying your burdens for you, any more than the fact that right now everybody in America just about has to get auto insurance. Nobody considers that a tax increase. People say to themselves, that is a fair way to make sure that if you hit my car, that I'm not covering all the costs.
But it may be fair, it may be good public policy.
No, but George, you can't just make up that language and decide that that's called a tax increase.
That the mandate would be unconstitutional under the Commerce Clause. But he did find a reason that it is constitutional. I want to read from it. The Chief Justice in the majority decision writes, the Affordable Care Act's requirement that certain individuals pay a financial penalty for not obtaining health insurance may reasonably be characterized as a tax. Because the Constitution permits such a tax, it is not our role to forbid it or to pass upon its wisdom or fairness.
Webster's Dictionary. Tax, a charge usually of money imposed by authority on persons or property for public purposes.
George, the fact that you looked up Merriam's dictionary, the definition of tax increase, indicates to me that you're stretching a little bit right now.
Ideally, they would want everyone to get health insurance and no one to pay the penalty, so they would raise no revenue. So there's an important distinction there, and that distinction matters in terms of what powers Congress is using when they enact this penalty, or tax, as we now know, and it also matters in terms of what the people know that Congress is doing, because now we know that they taxed us.
They sold it as a regulation. Obama said that this was not going to be a new tax, and now we have effectively a bait and switch that the court worked in conjunction with Congress.
Otherwise, you wouldn't have gone to the dictionary to check on the definition.
Well, no.
I mean, if what you're saying is...
I wanted to check for myself, but your critics say it is a tax increase.
My critics say everything's a tax increase. My critics say that I'm taking over every sector of the economy. You know that. Look, we can have a legitimate debate about whether or not we're going to have an individual mandate or not. But
you reject that it's a tax increase.
I absolutely reject that notion.
Welcome back. Julie Rovner, Chief Washington Correspondent with Kaiser Health News, here to talk about the Affordable Care Act. Let me read from the Fifth Circuit Court of Appeals, their recent ruling. The individual mandate is unconstitutional because it can no longer be read as a tax, and there is no other constitutional provision that justifies this exercise of congressional power. On the severability question, we remand to the district court to provide additional analysis of the provisions of the ACA as they currently exist. It may still be that none of the ACA is severable from the individual mandate, even after this inquiry is concluded. It may be that all of the ACA is severable from the individual mandate. It may also be that some of the ACA is severable from the individual mandate and some is not. What did they rule?
It helps to go back to 2017 when the Republicans had the White House, the House, and the Senate, and they wanted to repeal and replace the Affordable Care Act. And it was a budget reconciliation bill. There were all kinds of, rules because they were trying to pass it with just 50 votes. But what they did say is that in the individual mandate, your choice is you either have health insurance or you pay a penalty. And after 2017, the rule was you either buy health insurance or you pay a penalty of $0. In January or February of 2018, a group of Republican attorneys general said, if there is no tax anymore, if the tax is zero, then the mandate is no longer constitutional, because in 2012, when the Supreme Court upheld the entire law, Chief Justice Roberts wrote that this would be unconstitutional, except it's a tax and therefore appropriate use of Congress's taxing power, and it's all okay. Now, I should mention that lawyers on both sides of the Affordable Care Act think this is a very dubious argument, and they're reading the individual mandate to say that you shall have health insurance rather than a choice between you shall have health insurance or pay this tax. That without the tax, there's some freestanding requirement for people to have health insurance, which there really isn't.
And so they went to court. They found a judge in Texas who agreed with them. That ruling came down about a year ago this week. And that judge said that not only is the individual mandate as it currently exists post the tax bill unconstitutional, but because it is so intertwined with the rest of the law, that the entire law has to fall. And the Democratic attorneys general who were defending the law went to the appeals court, which had its hearing in July and finally ruled this week and said, yeah, we agree with the lower court that the individual mandate as it now stands is unconstitutional. One of the things that Congress did this week is repeal several of the taxes that we're paying for the Affordable Care Act. Turns out the benefits took them a while. They're really popular, but boy, the medical device industry and the health insurance industry and employers who have, generous plans and workers who have those generous plans from their employers, they all didn't like the taxes that were out there. And as part of the big spending bill that the Senate passed yesterday, those taxes are going away.
And how much money were they providing, or can you give me a ballpark?
I did this a couple of weeks ago. Interestingly, it wasn't, I would have thought, particularly the Cadillac tax, which is big.
That's the medical device tax?
No, the Cadillac tax is the 40% excise tax on very generous health plans. It's never taken effect. It was supposed to take effect, I think, in 2018, and they kept pushing it back. The medical device tax and the health insurance tax, one a tax on medical device makers and one on health insurers. And the theory when Congress did this in 2010 is that all of these industries were going to benefit by more people having insurance, so they would be able to afford more medical care. So they might this was an idea of taking back a little bit of the windfall that the health industry was getting, but the health industry fought a pretty public battle to make these taxes go away. But interestingly, the two largest moneymakers of the taxes that are paying for the Affordable Care Act are a couple of taxes on wealthy people. There was an increase in the payroll tax. There were a couple of other taxes aimed at truly wealthy people, like $500,000 million in income people, and those are actually collecting the bulk of the money.
Hundreds of meetings. We made hundreds of amendments. It was all very transparent. The president had a great meeting where he invited in the Republicans for an open press session to answer all of their questions. It was a collaborative effort. The intent was to make it bipartisan, and the intent was to be open and honest with the American people.
There are some fundamental differences between us here that we cannot paper over. And, Mr. President, when you said that this is a philosophical debate and it's a legitimate debate, I agree with that. We do not agree about the fundamental question of who should be mostly in charge. And you identified this question as central. Do you trust the states or do you trust Washington? Do you trust patients and doctors making the decision or do you trust Washington? Now, there's a mix of both, of course, in healthcare. But there is a big difference between our approaches. And there is so much in the bills that you've supported that puts control in Washington that we have a very difficult time supporting those provisions.
FDA took decision-making out of the hands of doctors, patients, and insurers and put it into the hands of politicians and bureaucrats. The problem is politicians and bureaucrats have neither the information nor the incentive to make prudent decisions for others.
In respect, you're wrong about the bill. Your bill would increase premiums, I believe. You say it wouldn't. So rather than argue with you in public about it, I'd like to put my facts down, give them to you. Maybe other colleagues will say that. As far as Mike Enzie's proposal, he's ready to talk about it. Mm-hmm. Others are. So I appreciate the opportunity that Mitch and John gave me to talk. You've made some interesting points, and why not let other members of Congress have a chance to talk?
I think it's a great idea. I'd like to get this issue settled about whether premiums are reduced before we leave today, because I'm pretty certain I'm not wrong.
But now the White House admits the Affordable Care Act isn't going to be so affordable after all. Obamacare premiums are set to drastically spike next year by an average of 25%. So if you live in Arizona, they might increase by 116%. Other battleground states like Pennsylvania and North Carolina could see hikes on average of 53 and 40%. So premiums are skyrocketing, as many critics predicted, but don't blame the president, says the president.
A lot of times, they just report premium increases, and everybody thinks, wow, my insurance rates are going up. Must be Obama's fault. Even though you don't get health insurance through Obamacare, you get it through your job.
And if you've got health care, we're going to work with your employer to lower your premiums by $2,500 per family per year. we're going to work with your employer to lower the cost of your premiums by up to $2,500 a year.
Even though your increases have gone up a lot slower.
And we'll cut the cost of a typical family's health care by up to $2,500 per year.
Here's what changes, saying to people who already have health insurance and the employers who are providing it, we'll work to lower your premiums by up to $2,500 per family per year.
I also have a health care plan that would save the average family $2,500 on their premiums. And if you already have health care, then we're going to reduce costs an average of $2,500 per family on premium.
You know, or suddenly you're paying a bigger copay and, thanks, Obama.
The deductibles in the Affordable Care Act, some of the plans, particularly the lower tier plans, can be $7,000 or $8,000. So it's people say, well, I'm buying insurance, but it doesn't cover what I need, and it is a big problem.
And well, no, I had nothing to do with that.
The CEO of eHealth.
It's frustrating, as an eHealth CEO who talks to customers every single day, by the tens of the thousands every week. They have declared this legislation that it doesn't work for them. It's horrible for the middle class. It's horrible for job creators. ACA was well intended. The guaranteed issue, which is maintained by AHCA, has been a good thing. But almost every other aspect of ACA has failed. Insurers have lost hundreds of millions of dollars. They've left the market. The middle class have been priced out of the marketplace. Premiums have doubled. Deductibles have doubled. Effectively, people in the middle class, the working class, they are effectively self-insured.
You know, Scott, the big complaint by the CBO, or what people are citing in the CBO report, though, is that 23 million people will be uninsured, which is an increase.
Now, that's what Americans who have health insurance can expect from this plan. More security and more stability. But let's also call it what it is. It is a lie.
Heard about the controversies within the bill, the process about the bill, one of the items. But I don't know if you have heard that it is a legislation for the future. Not just about health care for America, but about a healthier America, where preventive care is not something that you have to pay a deductible for or out of pocket. That prevention is about diet, not diabetes. But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
The Democrats have gone crazy.